Hello, my name is Ashley Bolin, and I will be presenting my Perinatal Depression Prevention project. So my population of interest is perinatal women of the Jefferson County and surrounding counties, with a focus on those receiving care from Eastern OBGYN in Birmingham, Alabama, which are responsible for 600 deliveries a year approximately. Jefferson County accounts for 8,650 births a year, and their cesarean rate is a bit higher at 35% than the national average, followed by a higher teen birth rate, preterm delivery rate, and low infant birth weight. Issue of concern is perinatal depression. This is depression that occurs during pregnancy, after delivery, or 1 year postpartum, where perinatal women are a higher risk for developing depression due to the drastic hormone change that happens. And it affects mother's health and baby's health. And it's one of the most common obstetrical complications in the U.S., with up to 23% of women experiencing depression sometime during pregnancy or after delivery, and as much as 50% going undiagnosed and untreated. So the issue of concern for signs and symptoms of perinatal depression is depressed mood, severe mood swings, difficulty bonding with baby, loss of feelings of happiness, also feeling hopeless and worthless, and even thoughts of harming yourself or harming the baby. The 5 sub-roles of the APHN as educator are identifying that population of perinatal women and working to implement a program for education. The clinician is the one that screens and helps to diagnose the women suffering from perinatal depression. The collaborator will work with fellow practitioners on ways to treat women with perinatal depression. The researcher will look at current statistics and how to better develop a perinatal depression prevention program. And the advocate and change agent is one that works to better meet the needs of women, perinatal women, and will work to make change within the program. So as perinatal depression relates to Healthy People 2020, the first initiative is to improve health and well-being of infant and children, and the second is to improve mental health through prevention and ensuring access to care, with the 5 key domains of linking to high levels of social support, positively influencing health outcomes. So again, we see the clinician, the educator, consultant, researcher, and advocate roles, where the clinician is providing the screenings, the educator is giving the education, the consultant is working with those practitioners, the researcher is looking at statistics to better make the program better, and the advocate is working to put the change in place. So the literature review that was done was evidence-based research articles published in one of the last 5 years, and they all had to pertain to perinatal patients and depression, with the first article looking at high levels of thyroid hormones as it relates to perinatal depression. The second looking at complications during pregnancy as it relates to perinatal depression. And the third looking at interventions to prevent perinatal depression. So some environmental and individual agents. The number one biggest risk for developing perinatal depression was lack of support, along with history depression or family history depression, and other things like complications, illnesses, unplanned pregnancy, low socioeconomic status. As far as regard to the appraisal checklist, and just know that all 3 of the summaries based on the JBI critical appraisal tool, they were able to be included. So when you're looking at prevention, primary is key. It's always preferred, but if the women are already suffering from depression, the efforts are considered secondary. And these are at halting the progression and working to improve the health outcomes. So again, once again, we're talking about that clinician doing the depression screenings, the educator implementing the education and teaching these moms about signs and symptoms and ways to get help, the consultant working with those care providers to better implement a program that would help, and that change agent working to make changes to the program that would better serve the needs of the community. And the researcher that looks at data previously and current data to see how well the program is working. So the nursing theorist that I followed was Lydia Hall on her care, cure, and core model. So the care is the hands-on. That's the care that the patient receives at the hospital, at prenatal visits. The core is the social and emotional needs through counseling and efforts to prevent the perinatal depression. And the cure is actual treatment of the person. That's different things that work to help them, support groups, and maybe medication or counseling, psychotherapy. So the summary of the needs assessment, basically we've already went over that. We looked at Jefferson County, and based on the needs voiced by pregnant patients and practitioners, saying that they do feel like there's a need for education for perinatal depression. There's only one postpartum support group for moms to meet for support groups, and there's no counselors in the Birmingham area. So the priority for the education program was to initiate proper screening, which has already been done at Eastern OBGYN, but screening allows for them to be referred to treatment and provides the maximum benefits. So the proposed educational plan was to begin with the screenings that were already being done, and then initiate the education, which is telling the patient and the family about signs and symptoms, ways to prevent depression, resources, treatment options, helplines, and referring them to support groups and planning a follow-up phone call. The handout that I kind of looked at to base my template on for my education handout was Pregnancy and the Life with a New Baby, or Not Always What You Expect. It had good readability and it was high quality. And it was also available in Spanish. Touch on a little bit of the summary of Jefferson County. So it is one of the most populous counties of Alabama, and it's huge as far as industrialization. But back in 1996, with the sewer system scandal, they were winning $4 billion in debt, and it caused huge issues with the county as far as like county jails were overpopulated, roads were hazardous. It was a horrible situation. Local government structure. So Jefferson County is a council manager form, which is governed by 5 council members, commissioners, and they are as listed: LaShonda Scales, Sheila Tyson, Jimmy Stevens, Joe Knight, and Steve Ammons. U.S. Congress representation is based upon Alabama representation in state, as well as, so Alabama has 7 representatives. Health policies that we looked at was prenatal care to prevent hepatitis B virus transmission, U.S. government and global maternal child health efforts, and reducing maternal morbidity. ANA Code of Ethics, the way it ties in is it's saying that there is a call for the provision of human rights for the protection to a particular attention to vulnerable groups, which are women and children. Health policy advocacy is main things is providing education, ensuring adequate competencies for the people caring for these moms, and encouraging government officials to strengthen health policies and provide education. Education is key. So demographics, we've already went over this a little bit, but something I did like to point out is the fact that the average household size is 2.45 with a median property level of $160,000, which is pretty good, and a poverty rate of 17.6. As far as health statistics go, the disease prevalence, the top 5 disease prevalence was stroke, cancer, chronic lower respiratory disease, and diabetes. And as far as the 5 leading causes of death, heart disease, cancer, stroke, accidents, and lower respiratory disease. The 5 most communicable diseases were chlamydia, gonorrhea, syphilis, tuberculosis, and HIV. Infant mortality rate was 537 per 1,000 births. Mothers, we talked about this, born to less than 20 years, so teen births was 64%. And there's a violent crime of 770%, which is very alarming. So when comparing the data, Jefferson County seems to be a thriving, county, but yet they are suffering with communicable diseases, and they are around the same as the state as far as leading causes of death. With the windshield survey, I drove around the Trussville area and looked at the buildings and the ages of the houses and the appearance. And everything, to me, the conditions of the roads looked to be in better condition than, certain parts of the community. But they had several resources, police and fire stations, family practice units, dental offices. The health ranking of Jefferson County is 26 among 67, and which the best areas were clinical care and health behaviors. So there's a bunch of resources for these community sports complex, senior center, playgrounds, membership to fitness centers, pharmacies, a bunch of urgent care facilities. So the summary of the key leader interviews, I asked them 3 questions. What is your perception of prevailing health needs of perinatal women within the Jefferson County area? What are your personal concerns regarding issues of perinatal women within the Jefferson County area? And what resources are available to the women within the Jefferson County area? And Lori Chandler, the clinical manager, said that education was the biggest prevailing health need and lack of education. And that moms just had a unrealistic expectation. And she listed some resources for moms as well. John James was the medical office manager there. And he said nutrition counseling was one of the biggest problems, that the moms did not have adequate nutrition education, and overall just lack of education on the cost of raising a family. So there's 3 priority diagnoses, one being high prevalence rate of depression. The second was increased rate of hypertension related to the lack of prenatal nutrition counseling. And the third was increased rate of uncontrolled diabetes related to lack of prenatal diabetes nutrition. But my priority community diagnosis was high prevalence rate of depression among perinatal women related to lack of support during pregnancy as manifested by increased depression screenings during the perinatal period. So what population interventions can we do? Implement this project at Eastern OBGYN and continue to incorporate project education in breastfeeding classes and mommy and me classes and support groups, and work to provide health fairs and courses, and at the Baby Palooza coming up, I think would be huge. So the planned intervention was to educate the healthcare providers on the importance of screening, and after screening, giving these moms handouts on signs and symptoms, resources, ways to get help, and emergency contact numbers. Also a link to an educational video, and refer to support groups, and a 2-week follow-up phone call. So it was there was plan objectives to provide education to the providers, and to screen moms and give them a handout with a link to a video, and provide those follow-up phone calls. The resources were going to be the financial for the care providers to do the screenings, for paying for the cost of making the handouts, and televisions for the videos, equipment, paper, ink, paper, pens, and the facility resource. But barriers, it was difficult to get the practitioners to provide the education needed. Couldn't get the handout finished. Well, I got it finished, but it was not able to be incorporated, and not having the nurse to provide the call at 2 weeks follow-up. So the team members were the medical assistants, the practitioners, the nurses, and the office managers. And the stakeholders are the ones receiving the care, for the ones providing the care, the insurance companies that are billing for the care, and the government that provide the Medicare and Medicaid. So future recommendations for anybody that's going to embark on an educational project such as this is to think bigger. Teach classes in the community and offer incentives for these classes, such as free diapers, wipes, and coupons, and have all the teaching materials that you need prior to the educational classes. So in conclusion, perinatal women are at very high risk for developing depression due to the drastic hormone changes during pregnancy. And it can not only affect mother's health, but it can affect the baby's health as well. There's no infant bonding. Our mother feels very depressed mood. She don't want to care for the baby, or she'll have thoughts of harming herself and the baby. And it's the most common obstetrical complication. So there's a need for implementation of the Perinatal Depression Prevention Program. And hopefully through this implementation, it can grow and be taught in community classes and can reach numerous perinatal women across the state. Here's the list of my references that I have used throughout this project, just to name a few. And I would like to thank you for taking the time to listen to my delivery of the Perinatal Depression Prevention Project. Thank you so much, and have a wonderful day. Bye-bye.